Welcome to the Complete Physical Exam Companion video to the Ultimate Medical Scribe Handbook. In this video, you will witness the physical exam as it is performed in the emergency department by an emergency department physician. The subtitles will reveal the normal physical exam documentation that would accompany this portion of the physical exam. Please keep in mind that there will be significant variety with regards to physician requirements for the medical scribe documenting normal physical exam findings. This video is designed as a simple introduction to these concepts. Also keep in mind that the bulk of physical exam findings will be documented in either a templated manner or a pick and click fashion. This will make the scribe job substantially easier. But it is still of fundamental importance that the scribe understand the general physical exam and documentation of both normal and abnormal physical exam findings. As stated, we will focus on predominantly the normal findings in this video.
Alright, so we're going to get started on your physical exam.
The first physical exam finding noted by the physician as they enter the room will be the patient's general appearance. Do they appear uncomfortable? Are they pleasant? Are they unpleasant? Are they yelling? Are they moaning? What is the patient's general body habitus? Are there any other dramatic abnormalities such as poor grooming or other issues that are obviously noticeable on gross examination of the patient? In this example, we have simply documented under the general portion of the physical exam that the patient is pleasant, well-nourished, in no acute distress, or NAD. There will be significant variety in what the physician wants the scribe to document in the general exam category. This is one section of the physical exam where the scribe will be able to perform some independent documentation. If the patient is obviously screaming or moaning, this can be documented under the general exam. If it is obvious that the patient is extremely uncomfortable, it is easy for the scribe to document this in these exam findings. The physician will also frequently prompt the general physical exam findings to the scribe by dictating as you leave the room.
Let's start with doing your scalp, checking out your scalp and your head.
The physical exam will frequently progress from the head to the toe, although a slightly more chaotic exam is also common in the emergency department. Examination of the head, eyes, ears, nose, and throat, or ENT, is the first part of the physical exam. In this segment, the physician is feeling the patient's head. Normal cephalic means that the patient has a normal head shape. Atraumatic means that there's obviously no trauma to the head. It should be noted that frequently templates will have the baseline HEENT finding as normal cephalic atraumatic, so it is important to erase the atraumatic section of this exam if the patient has obvious trauma to their head, such as a hematoma, a bump, or a laceration. You have seen the brief introduction to the Complete Physical Exam video companion to the Ultimate Medical Scribe Handbook. Please feel free to visit medicalscribetraining.net for our additional training videos, including our Complete Scribe Training Package, which includes in-depth analysis on all aspects of the medical note, not just a complete physical exam tutorial, but also in-depth analysis of the HPI, documentation of emergency department course, including consultations and disposition, and all other aspects of the note. Lastly, scribes are able to perform virtual shifts in which they simultaneously document on multiple patients in a virtual video setting. The scribes can then be evaluated on their complete documentation that is performed on these patients. Please feel free to visit us at medicalscribetraining.net, and also feel free to visit our companion handbook site at www.medicalscribetrainingbook.com or search for the Ultimate Medical Scribe Handbook on Amazon. Thank you.